Hi everyone. Okay, so I just spoke to Dr. Ankita and she's going to be joining in a minute and we're going to talk about STIs and safer sex. So, yep. Hi, I'm sorry, we're finally there. And yeah, we're going to be starting in a minute. Till then, if you have any questions related to the topic, you can drop them.
Hello. Hi.
Hi, finally.
Finally.
Hi, I'm so sorry for this.
It's okay,
Yeah.
no problem.
Okay, cool. So, hi, Dr. Pragati, do you want to give your introduction and
Yes,
maybe
sure.
introduce Pragati for her also?
Definitely, yeah. So, hi everyone. Myself, Dr. Pragati. I am a pathologist. Pathologist means a lab doctor, and I work for Proactive for Her. So, Proactive for Her is a platform that works for women health fitness. So we deal with a lot of things like sexual health, period related problems, in general, all female related problems. So yes, it's a very exciting place to work for somebody who is very passionate about female health. So yeah, here I am. So today we are talking about STIs. Yes.
Yes, let's go. Okay, so dang, I did not know a lot of that. So I have a lot of questions for you, for myself too, because I realized while doing a lot of research that I don't know a lot of specific questions about STIs. So
Sure.
I'm just gonna ask you a few questions and then we can take questions from the audience.
Sure.
Cool. Okay, so one of my first questions that we've also gotten a lot from the audience is, can STIs subside on their own?
Okay, so there are a lot of STIs, okay? They can be caused by bacteria, viruses. So a few STIs do subside on their own, but the wise thing would be to not wait them to subside, because
So,
what happens is if you have symptoms, the symptoms might flare up sometime or they might ebb other times. Okay, so sometimes when the symptoms go, your infection has resolved on its own, but other times it has just reduced on its own and it might flare up again. So there's no way to know whether, unless you get tested, there's no way to know whether it has gone on its own.
right.
Yeah. So I mean, so
Okay,
the wise thing would be to not wait for it to resolve on its own, because not all of the STIs resolve. Some do. Some definitely do.
right. Cool, that's good to know. I guess as Indians, we're all just always just like looking for a way out. We don't want to go to the
Yeah, for
doctor.
the
We avoid
easy,
it in
I
general.
know, something which is easy to do and easy to accept. It's how convenient. Okay, the STI will resolve on its own. But then
Yeah,
by the time it resolves, it can cause a lot of damage. So that is the problem.
right.
Yes.
Okay. Uh, Again, one of the questions like really, important that I have personally come across, like uh, injections like PrEP and PEP, uh, I've always heard about them being available in like, non-Indian countries, whatever, what am I saying? Anyway, but I have no idea how much, pre-exposure prophylaxis or post-exposure prophylaxis are available in India. Also, can you explain what those are exactly so that everyone can
Okay,
know?
okay. So actually, there is no pre-exposure prophylaxis or post-exposure prophylaxis available in India except for HIV. Okay. For HIV,
Okay.
there is post-exposure prophylaxis, but there's nothing like a
Mhm.
pre-exposure prophylaxis.
Right.
Okay. So, and for HIV, if you feel that you have been infected, or if you feel that you might have been exposed to HIV, then within 72 hours you have to go to a doctor, tell them, and then they will prescribe you a prophylactic treatment. This is the
Right.
post-exposure prophylaxis. It has to be within 72 hours, not later than that.
Right.
Like you can take it later also, but then the effectivity of the treatment decreases. So it's not as efficacious then. Other than
Right.
HIV, we don't have any pre-exposure or post-exposure prophylaxis for any of the other sexually transmitted infections.
Okay. We got a question that says, having more than 2 rounds with condoms, does the condom blow up? I don't think it does, but you should not be using the same condom twice. So let's keep that in mind for next time. Okay. Again, very popular question. Can you contract blood from period blood? Like, can you contract an STI from period blood?
So, some people feel that it's safe to practice intercourse during periods because there are lesser chance of getting infected. I think that
Mhm.
belief is there, but there is nothing like that. Irrespective of whether your partner is menstruating, you can still get a STI if the partner is infected.
Right.
So, as in, we can't blame pre-period blood here. The period blood has nothing to do with it per se. If the partner is infected, you will get STI irrespective of whether the partner is menstruating.
Right. And okay, so someone has asked, any side effects of post-exposure prophylaxis?
Um, for HIV, that is because that's the
Yeah.
only one which we are talking about here. Not
Yeah,
really,
yeah.
there might be some nausea because of the medication. That is it, more or less. No major side effects.
Right. Also, is it like easily available, or is it something, still
No,
very
it
taboo?
is
Like,
no, it is easily available. You can go to any hospital or any medical institution and probably ask for it. You can go to a physician and explain it to them, and they will guide you to where to get it from.
right. Okay, that's great to hear. I'm gonna take a few more of the audience questions. Okay. I went to the doctor after having first one. They didn't told me about HIV. I'm really sorry to hear that. Okay. Um, okay, does having another STI, like a pre-existing STI condition, make you more vulnerable to another STI?
Yes, because it depends. Like if you have ongoing infection, you have a ulcer, you have broken skin, or you have bleeding somewhere, so that kind of increases your chance of getting another infection through it if there's a discontinuity. So, like herpes is one infection that presents with ulcer. Syphilis can have a ulcer. So, if you already have that, then there are more chances of getting infected by other infections like HIV or hepatitis B. So, yeah, that's true.
Okay, that's okay, good to know. Also, there's a lot of people like don't know why people have, shifted to the STI language rather than the STD. So can you like explain how not all
Yeah,
STIs turn into STDs?
right, right. So, STI is a sexually transmitted infection. STD is sexually transmitted disease. So, what happens is when the causing pathogen, the organism which causes the infection, when it enters your body, you are infected. Okay, but when you start having symptoms of it, then it is called a disease, right? So,
Right.
so it's almost like HIV and AIDS. Okay, so when you have the human immunodeficiency virus in your body, you are said to be HIV positive. But that doesn't mean you have AIDS. AIDS is when you have symptoms due to that virus, when you have full-fledged disease. So that is AIDS. So similarly, there is like STI and STD. When you start having symptoms, then it is called a disease. If you're just infected, it's only called an infection. So
Right.
because a lot of STIs do not present with symptoms at all, you just harbor that organism in your body. So that is why the more commonly acceptable medical terminology now is STI rather than STD. That's the only
Right.
reason.
And like you said, like you talked about HIV. So, like how it's really difficult to diagnose STIs in the beginning because, it doesn't really show any symptoms. You don't really know
Hmm.
how to, when to get checked. So,
Yeah.
how do people like catch? Is there any guidelines that they should follow that to catch HIV in the earlier stages so that it doesn't turn into AIDS?
Yeah, so if it, the one should get tested if it depends on a person's behavior. Like if somebody is in a monogamous relationship and they have had themselves tested once and they were negative, then probably it is not important to get yourself tested for HIV time and again. But if somebody is in relationship with multiple partners or if they are practicing any risky sexual behavior, then it is advisable to get yourself tested every year, at least once per year, or whenever you feel that you have had exposure with a new partner, or whenever you feel you have shared a syringe or anything of that sort which could have led to infection. So it's better to get yourself tested. And another thing here, which is like you probably would not be positive immediately. So
Right.
you should get tested immediately. But if the test is negative, repeat it after 6 weeks. Again, 6 to 8 weeks. Because HIV, there's a window period when before the test turns positive. So that
Yeah.
is one thing to remember here. So obviously, if you have to be mindful. You have to practice safer sex, and if at all you feel that you might have been exposed, it's better to get yourself tested.
Right.
And this is
Absolutely.
not just for HIV. This is for all the other STIs also.
Right. Okay, someone has asked, could you please tell us more about the dental dams in case of oral sex? Is the use of dental dam mandatory? How easily is
So
it available?
dental dams help to prevent the transmission of infection. And how easily that is available, even I can't tell you that because I'm a lab doctor per se. I think a gynecologist might be able to help here because I'm not sure how frequently they're available in India. But there are many
Mm.
DIYs available on internet. If
Yeah.
you search, there are many DIY dental dams available, which like you can make on your own, of course. So yeah, I think, but they do protect, and it's advisable to use them for oral sex.
Right. Okay. And you can make a dental dam out of a condom, like after cutting a
Yeah,
cord.
yeah, that's what. Yeah.
So that's pretty convenient, I think. And we can share that later if required. So thank you so much for that question. Okay. So, right, I'm gonna ask another one of the things. So, a lot of people have doubts about going to the doctor, and especially about STI testing, because they don't really know what to expect, right? Because you go to cold, your doctor's gonna check your mouth and take your breathing, but nobody really actually knows what happens when you go to an STI testing. So,
I'm
what
sorry, I
can
didn't
people
get the
expect?
question.
Yeah, I'm just asking what can people expect out of this? I'm sorry, I'm a
For
little
STI
vague.
testing,
Yeah, yeah, yeah.
it's very simple. It's very, very simple. So you just have to give your blood sample and your urine sample. That's it. So it's almost like any other test. It's like just like you give your blood for a blood sugar level or a lipid profile. It's as simple as that. There is nothing complicated about it. So you just have to like, for example, if you use our platform, the Proactive for Her platform, you just have to go on the page which says Sexual Health. There you will get STI testing. When you click on STI testing, they take you to the packages which we have, like which one you should opt for. There is also a pre-test consultation available. If you can't understand which test you want to go for, you can always take a consultation from one of our doctors, and they will guide you to which tests you should take. And you have finalized, once you have decided that you are going to go ahead, you just book your test and you have a person coming either to your home or you can walk into a nearest lab and just give your blood sample and your urine sample. It's as simple as that. It's a very simple flow of things.
Wow, that's very convenient.
Yeah.
Okay, so how important is it to clean the vagina after sex? If not, what will happen? Okay, someone asked this question. If I think what they're trying to ask if it's like relevant to preventing STIs in any way.
So a few studies do show that the risk of transmission decreases if you wash after having intercourse. And anyways, it's a good practice because the risk of UTI also decreases, the urinary tract
Yeah.
infections. So yes, it's always advisable to wash with at least with water, if not with soap.
Right. Okay. So I'm gonna ask a few of my questions because I can't find any more. Okay. Okay, so what is the kind of procedure if like someone comes in and they have no idea what kind of STI they have contracted, or
Mm.
if they just think kind of there's something wrong with them sexually, but they are not really sure what kind of STI they have contracted?
Yeah, so this is a very common problem because people are not sure whether they have been exposed or not. Should they get tested for STI? So that's a concern with a lot of people. So what we have is we have a pre-test consultation. Okay, it's a free consultation which is available on our platform where you talk to a doctor and you are told all your questions are answered there. So any doubts related to STI testing, you can always take a free consult and the doctor will help you to understand which tests you should take, whether you have been exposed, what you should do basically. So it's very simple there. You don't need, it's a no-brainer. Just go ahead, book a consult and be guided and eventually take whatever test you have been told to take. That's all.
Okay, so I'm a little curious, like, you know how people from 18 to, like a certain age in their 20s, they're at a higher risk of, STI transmission because, they're just starting to have sex and they don't really know a lot.
Correct. Yeah.
They don't have a lot of awareness, right? So how many people, do you see getting regularly tested?
So a lot of people these days, actually, even very young people like college going students and all, they are very conscious about their sexual health and they try to take things there in their hand and not just themselves, their partners also. We get a lot of couple bookings also.
Right.
So yeah, so these days, I mean, probably if we were talking 5 years before now, it would not have been so common. But now I feel it's pretty common, and people like to take their health and especially their sexual health in their hands, and they want to invest in it. Like these tests are a little expensive, but still people want to invest in it because it's almost as expensive as your two outings or two dates. So I mean, why
Yeah.
not just save up and be in control of your sexual health? So a
Right.
lot of people these days are getting themselves tested, and which is a very good thing. It's a very responsible attitude, even college students.
Wow. Yeah, that is amazing to hear actually that, some of the messages are going through and people are actually starting to care.
Correct.
Okay.
Correct.
So, we have a question, is oral sex safe? Is oral sex safe for my partner if I have hepatitis B?
No, there is a
Okay.
risk of transmission. In any form of sexual encounter, there's a risk of transmission.
Right. Uh, is STI possible if one person can hug who just engaged in sexual activity? I don't think it is, but I'm gonna hand it over to Doc.
I think hugging is okay. Hugging is not a problem.
Yeah, you're good.
Yeah, you're
Cool.
good.
Okay. Okay. So one of the things that I came across while I was studying a lot about STIs is how pregnant women get STIs and they're not really sure they contracted it, and later it can cause problems, right? So can you tell
Yeah.
us a little bit about pregnancy and
So
STIs?
yeah, so what happens is if you are pregnant and you already have a STI, there's a chance of transmitting it to the unborn baby, like to the embryo. Okay, so and then it can lead to other complications also with the baby. So what is practice is usually when a person goes to the gynecologist doctor, obstetrician doctor, like the baby doctor for the first time. So usually they get them tested for the STIs, and if something is positive, it is treated there and then. So it's a good practice when somebody gets pregnant, so early on only you should get yourself tested for STI so that if there is a problem, you are treated there and then and no harm is done to the baby. So in pregnancy, actually, it becomes all the more important to know that what is your STI status.
Right. Also, just like out of curiosity, what is the, treatment process like? Like, how long does it take? What kind
So
of,
it depends on which STI we are talking about. Some of them can be treated with even a single dose of antibiotic. And for others, you
right,
have to take lifelong medications. So, for example, syphilis, gonorrhea, these can be treated fairly easily with antibiotics. But HIV, hepatitis B, they have to be managed throughout your life. You have to take medication throughout your life. So not a single treatment fits all. It depends on what STI we are talking about.
right. And one of the questions that I was doing, I was doing an AMA recently and I got was how do I ask my partner to get tested without offending them
Yeah,
or something?
this is very important. So first thing is you should reveal your own STI status first. So it's very important. It's not like you don't know what is your status and you are telling your partner, okay, you get tested, right? So
No.
like you have to know your status, you have to reveal it to them. Then you have to normalize it. Like there doesn't have to be a taboo
Mhm.
about it. It's about taking care of each other. Like if you want to take care of other person should take care of you. So it's about staying safe and like no, it's about letting go of all the tension. Once you know that both of you are negative, both of you are safe, obviously any of your sexual engagements and encounters can be more pleasurable without that fear of being contracting anything. So like make a date out of it. Book a test, go ahead, get it done. It has to be normalized. It's almost like a health checkup. So many couples go for annual health checkups together. So many couples they go for gyms together. So why not go for STI testing together? I mean, it's also a part of your basic health. One has to normalize it. There shouldn't be a taboo around
I absolutely love that, and I think I'm going to be quoting you on that. Like, let's make a date out of it.
Yeah, sure.
Okay, okay. So, I'm gonna ask, right? Is STI possible with naked body cuddling, hugging without any penetration and just kissing? Okay.
Yes, it is possible because you might, if you have any oral lesions, then you can transmit it by kissing to your partner. And even if there is a genital contact without penetration, you can still get the STI if there is a ulcer or any cut or abrasion on a person's body. So yes, that is possible.
Okay. Right. Also, like coming back to what you said earlier, like, people are very, you know, it's a very taboo topic to sometimes talk about STIs or get tested. So I feel like the reason why a lot of people are not able to ask their partners to get tested also is because, people have created this kind of a narrative that STIs are
Hmm.
dirty and that there's something wrong
Yeah,
with it. But it's like nothing more than, basically like any other
and like any other
infection.
infection. Correct.
Yeah. Okay. So, um, I think I am done with a lot of my questions, but I'm
I
gonna
think we've
ask.
covered a lot of, I think we've covered
No,
almost all the
yeah,
aspects of STAs. Yeah, but if there's something more which audience have asked, then probably we can take it up.
yep. Okay, guys, please send your questions in through the question sticker, and yeah,
So, meanwhile, I think I would want to mention that through there is a coupon code I think through sexeducation.india.
right.
If you use that on the our platform, then they get I think 20% off if I'm not wrong on the
Yes,
STI testing. So this is a good time for anybody who wants to get tested to go ahead and get tested, save some money.
yes. Sex Ed India fam, go get yourself tested. Go get healthy.
Yes.
Okay. Okay. So, okay, just till we get more questions, what is it like, like working in a STI lab and, everything? Tell me about it.
It's almost like any other thing. Actually, the whole thing about the whole taboo about STIs in people's mind. Otherwise, it's almost like anything else.
Yes,
So yeah. So
I
I
agree.
mean, it's just like any other test. So it's pretty simple for a doctor. Like it is not as if it's something very different.
Okay, is by touching genital dry transmission possible? So yes, I think
Any
genital
sort
to
of
genital
contact, yeah,
contact.
any sort of
Yeah.
genital contact or oral contact can lead to STI transmission.
Yes, which is why you should be wearing a condom before you begin.
Correct. Yeah.
Okay. I think that's about it. Like, uh, all the questions that we have, I'm not getting any new questions.
Yeah,
So I think
I think
we're
we have
good.
covered a lot of things, and I just like before we end, I would just want to send out this message that everybody should take STI. It should be a normal thing. Like we have to normalize STI testing. It is not there is no
Yeah.
taboo. There should not be a taboo about STIs. They are very very common, and the best thing about them is like they are very easily treatable or manageable. So as early you diagnose, if you diagnose it early on, then you can get treated early and you can prevent a lot of complications. If you just let it be, if you suffer from it and you don't get treated, then it can lead to multiple complications. So I think the best thing, my advice for all the young people out there would be to get yourself tested at least annually or whenever you feel you have changed partners or you have had exposure. So I think it's pretty simple, and our platform like Proactive for Her has even simplified it further. Like it's
Yeah.
on click. You have to just click two buttons and book yourself a test, get a home collection done, or walk to a lab if you're not comfortable with home collection, and just be done with it. And once it's done, once you get your report, this peace of mind, you can enjoy your sexual relationship happily. So I mean, just don't think too much about it. Get yourself tested. Stay healthy. Stay safe. That is the funda here for STIs.
Yes, for sure. And yeah, I think let's end the live. And thank you so much for joining us today, Dr.
Sure.
Pragati.
Thanks for
It
having me
was
here.
really informative. And guys, check out Proactive for Her. Their website is incredibly easy to, manage and to see through.
Navigate. Yeah.
And you're gonna actually realize how STIs are not all that scary after all, and how
Yeah.
Proactive for Her makes it easier for you to go through this
Yes.
journey.
We have a lot of
Yeah.
educational material also. A lot of blogs are there which you can read up and understand things better. Rather than
Yeah,
like Googling things and then finding out wrong and right things. Don't
exactly.
sometimes you can get confused
Please,
what is right, what is not. So you'll have all the authentic doctor approved information on the website. Please go ahead and read it up.
yeah, please don't go to blogs that are not managed by medical
Medical
professionals.
professionals, yeah, right.
I made that mistake like 5 or 6 years ago. I would not want to go back.
No, 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 definitely.
Okay. Thank you so much, Dr. Pragati.
Thanks for having me here. Bye
No
bye.
worries. Yeah.